And don't forget about watching us, which you can do on your computer, your mobile device. Just head on over to SuperTalk TV. Okay, ladies who are listening to good things, as well as all you men who have a lady in your life that you love, this is for you because it is still February, which means it is Heart Health Month. And if you've got a heart too, it's good for you. But we are going to go red for women and talk about the importance of keeping up with our ladies' heart health. And joining us is Dr. Ardarian Pierre. She's the assistant professor at the University of Mississippi Medical Center. She's also a family medicine physician and a geriatric, say that one, I don't want to say a wise and years person's physician, but how do you say it?
Geriatrician.
I would have got geriatrics. I got, but geriatrician is a trick word. But she's also an author and a mother of 4, and so up to some good things. So welcome, Dr. Pierre.
Thank you for having me, Rebecca.
And you're beautiful in red, which means you get it. So as a woman to woman, and obviously a physician, how important is this idea of raising awareness for our women's health? At least once a month, if we should be doing it more often. But how important is it to sound the alarm on our heart health?
Well, it's very important. So oftentimes I'll ask my patients, hey, are you taking care of your family? Of course. Are you taking care of your kids? Yes, we're doing all of the activities. But how well are you taking care of your heart? And so most of them are like, you know what, Dr. Pierre, I'm not getting enough sleep. I'm not exercising. I'm not eating right. We're just eating, on the go. So awareness is important, and we love doing it every day. So we can do Heart Month every day as far as I'm concerned.
I know, and it's just that 1 month out of the year where we kind of talk about and they're not good statistics, but it's a good thing to sort of talk about, right? And when it comes to cardiovascular disease, Dr. Pierre, kind of where is that with women and our overall health or our lack of health?
So many women don't know, but 1/3 of our women are taken from us from heart disease, whether it's our mom, our sisters, our aunts, our neighbors. And again, it's about 44% of women that aren't informed about it. So this month is important just to make that awareness known and let them know and what they need to do to help.
Okay, so the numbers that we think about, because Dr. Pierre, I think women are already very aware of their weight or very aware of whatever, but that number to me, even as a dietitian, is not the one that matters the most when it comes to our heart health, right? I would love for ladies to sort of push that aside. We may not be what we want to be, but are we what we should be? And what we should be is whatever weight keeps what other numbers in check. So as a family physician, when you have a female patient or a male patient, to be honest, come in, what are the 1 or 2 biomarkers or numbers you're looking for that says this tells me more about your health than your pant size?
So we're looking, of course, at your blood pressure. So what do those numbers look like? And we'll also ask questions like, what do those numbers run at home? A lot of patients do not know. So we may send them back home to give them homework and say, let's keep a journal of what your blood pressure is looking like. We also look at a lipid panel. That's a big one for us, that we'll look at your cholesterol, your good cholesterol, your bad cholesterol, and just see how things are weighing out and what we may need to do. Another thing is your calcium score. We'll sometimes send patients to the cardiologist or send them in for screening to look at those numbers to see if you have calcium deposits and if there's anything that we need to do to help reduce your risk.
I know when it comes to blood pressure, I hear, I've got white coat syndrome. Every time I go to the doctor's office, my blood pressure rises. I walked from the parking garage or whatever it may be. So that at-home checking is so important, particularly, I guess, if heart disease runs in your family or if you have been told you have high blood pressure. Why is that one so important for men and women to kind of know on the regular, Dr. Pierre?
So oftentimes when you come to us, I say it's just a snapshot in time. We see the number today. It can be elevated, but it's important to know when it's running every day, just so we'll know, are we at the point where we need to add medications on board, or is it just a matter of losing weight? Is it what you're eating? Salt intake is a huge thing. And then a modifiable thing, something that makes a huge is a huge risk factor, is smoking. So, we want to talk through those things that increase your risk for those blood pressure numbers being elevated and what we can do to reduce your risk, which later on can lead to heart disease.
Now, as a family physician, you guys really are like the captain of a big ship that sort of helps families and individuals get the big picture of what your health looks like and then navigate maybe if you need referrals to other places. We always talk to patients, too, where I work and connected with about you got to have a captain of the ship. You got to have those annual physical and wellness exams, so you're just kind of not spread all over. You're like, yes, I know I'm talking your love language. But explain to those listening to Good Things, when it comes to not only your heart health, but overall, how important it is to have that family physician, that sort of point of reference to go and get these annual exams.
Yes. So one of the things that I love is prevention. Prevention is key to really a healthy life and a healthy quality of life. And so you need a quote unquote captain of the shift, someone who knows you, who has a relationship with you, who knows your family, who has asked the questions to say, oh yeah, my mom had hypertension or my mom passed away from a heart attack. So you need someone who knows what's going on, in your day-to-day lifetime or lifestyle, and within your family. And then we need to be able to know your age and what's going on so that we can make those referrals and refer or make recommendations for vaccinations and things that you need to remain healthy.
Now, at what point do I see a geriatrician? Did I get it right?
Yes.
I got it right.
Perfect.
So at what point do we switch over and have that? Because it just all those wise years of wisdom, it just requires a little bit extra attention to detail, I would assume.
Oh, yeah. So that's a great question. I often say all patients do not need a geriatrician. So once a patient reaches 65.
I was like, 85, man, clear. I'm good.
65, then from there, we decide, depending on what your chronic diseases are, what your state of life is, what your activity and day-to-day routine are, then we decide whether a geriatrician is needed. Also, it depends on what type of medications you're on. If you're on a whole list of medications, oftentimes, primary care physicians or what have you, they'll come to us for us to just look at the list and see, okay, we need this or we don't need this. So 65 years of age and older.
So you are obviously in the clinic every day and obviously are healthcare providers. So we have like the American Heart Association. I was like, my mind went completely blank there. Who helps really bring the awareness is the words I was looking for Go Red for Women, as well as all of these wonderful information. What does the campaign of Go Red for Women really mean during the month of February?
So during the month of February, it's just this, me being here today, raising awareness, helping us educate women to close these care gaps, to let them know what their risks are, to let them know things that they can do to reduce their risks. Okay, so that's the goal. We also want to raise funds to support the ability to do this, to raise awareness and to support research and do what we need to do to educate more women and hopefully save more lives.
And I know you mentioned 65, and then you're thinking about family physicians being like older. I know I'm in my 40s. I'm thinking about things differently. But you and I both have small children, and really educating them or instilling these values or health values in your family unit younger, they won't have to worry about as much when they get 65 or older. So how important is it, too, when you think about heart health, to also think about your kids' health in that?
I'm so glad you brought that up. So recently we did the color walk, and that's one thing that we did, again, to bring awareness and just telling them the importance of staying active and reducing salt and educating them on how to read labels, even at an early age. And, Mommy, why can't I have more candy? Well, this is why we can't have more candy. We want to watch your intake of those processed sugars and processed meats. So it is important. It's vital to educate them early so that as they age, they can age in a healthy manner.
Yeah, but just because heart disease or diabetes or stroke has been in your family's trend, yes, there's genetic components, but also you can break those cycles too with a little bit of education, a little bit of forethought, but then also knowing those important numbers and not being scared to come in and find them out. Would you say that too, Dr. Pierre? Come on in.
Yes, and I'm glad you said that, because oftentimes patients, or I'll meet people in the community and like, well, my doctor didn't have time to talk about my numbers today. It's like, no, if you have a physician or provider who does not have time to discuss your numbers, then you need to find someone else. I'm sorry to say that, but it's important for you to be comfortable to discuss your numbers and the expectations and your risk so that you're educated on how to better care for yourself.
I love that. Be your own health advocate.
Yes.
You deserve the right to have someone who walks and talks through that with you. There are good clinics out there.
Yes, of course.
Sort of for
We're right
that.
here in Mississippi.
Yeah, you are. If somebody wants to find you, Dr. Pierre, how do they do that?
Well, located at UMC, University Hospital. I'm at the Flowwood Clinic primarily, but you can pretty much find me anywhere. I'm also on Instagram at Pierre Docs. So if you have any questions, let me know.
Can you stick with us and talk about your book?
I can, sure.
Alrighty, stick with us with Dr. Pierre coming up next here on Good Things. .fm. We're also streaming from that SuperTalk Mississippi app and your local SuperTalk Mississippi radio station. But don't forget about watching us, which you can do on your computer, your mobile device. Just head on over to SuperTalk TV. Continuing our conversation with Dr. Pierre. She's an assistant professor at a University Medical Center, a family medicine physician, and a geriatrician. I got it right. I'm so proud of myself. But she's also the author of a children's book called Dr. Moms, which you authored with a colleague. Who'd you author it with?
This was authored with Dr. Charlene Collier, who is my personal OB, delivered 3 of my babies. She's amazing. Mm-hmm. And so that's how we met, and we just kind of grew from there.
So the idea of the book, like Dr. Moms, I love the name, kind of give us the presence of what the children's book's all about.
So it's really just expressing to our children what we went through to get to where we are today. So your mom went to class. She, studied anatomy and physiology. There's even an interactive page that's my favorite where they get to choose what type of doctor is your mom. And so it sparks conversation between mom and their dear babies to talk about the life of being a Dr. Mom.
Great children's book to coincide with our first guest with the Treasury and talking about getting a college savings, yes. Right? Because it starts with this idea of just having that conversation of what all it went into and then going into your higher education. Dr. Pierre, my oldest, asked me the other day, like, how long did you go to school, Mom, to be a dietitian, and sort of went through it. And we're right around 6 to 7 years, depending on which route you go. She was like, oh, well, what? She said, well, what about a doctor? I said, well, that 7 years is going to sound great after
exactly
after you hear about that. And I think it's good to have those conversations with your kids. So as your kids, have they gotten interested about what their mom does?
Yes, very much so. My oldest, he's decided he's going to be a cardiovascular surgeon.
Did you sit him down and make him read that book over?
Yes, they love the book. Some of them have memorized the book. Yeah. And so we'll see. So if in terms of, because healthcare is a tough, I guess, field for kids to want your kids to go into if you're sort of in that field. Do you feel like for yourself and Wells, your son, it's a calling if they want to go into healthcare? I do. I remember it's like yesterday, I was inspired by my personal pediatrician, Dr. Ivanzik in Tupelo. And so I just remember seeing that he had 9 kids, maybe had more at some point, and he could be a physician to take care of families, take care of kids, and be a dad. So I was inspired by that at the age of 5. And so I know that they'll enjoy doing it.
Of all the fields, you chose family medicine and then geriatrics to be a geriatrician. I'm going to say that name. I'm going to say that word as many times as I can now because I got it. Those are they're broad umbrellas within it. So you're kind of all in one when you're working in those fields. What drew you to those instead of maybe specializing what it sounds like your son wants to do?
Well, I love family. Family is the core. I just think about my village when I was growing up. We did everything as a family unit. And then the geriatrics part was because as a little girl, we went to church. We did a lot of missionary work. We would go to nursing homes. And a lot of the older folks there didn't have loved ones who would come see them or check on them. And they would just get so much energy from us being there playing bingo or singing with them as little kids. So from an early age, I was just inspired that this is really what I wanted to do, just to connect with older folks. I love it.
Wise in years.
Yes.
And two, for them not to give up on their health,
exactly.
Right? Because even if you're listening to good things and maybe you're in your 60s or 70s and maybe, it didn't turn out the way in terms of health, that's the cool part I've always loved about it, Dr. Pierre, with a good medical team and sort of taking good interventions. You may not reverse everything, yes, but you can improve your everyday well-being with just a little intention and good care.
Yes, and one thing that I love to focus on, they say, Dr. Pierre, I'm 65. I was like, that's not old.
Not anymore, anyway.
So we are focusing on healthy aging. So aging is something we're all doing as well as much as the clock is ticking, we're aging. So why not do it well?
Why not
take pride in it and enjoy it and do it in a healthy manner?
I love that too. And listening, I mean, again, what brought you here is the fact it's February, Go Red for Women and Heart Health, and it's never too late either to start thinking about that as well. I mean, there's no shame if you are, managing high blood pressure or high cholesterol or any of that. The cool part is at any age, you can sort of walk those steps back as much, or at least to some degree.
Yes, it is. We can prevent a lot of things, which is, I often say what you eat and what you do, like those are your superpowers. Mm-hmm. So, make your plate colorful. We often talk about the Mediterranean diet and the DASH diet. And yes, it has diet attached to it, but it's not really a diet. It's a way of life. And so if we can implement that, it will make a difference in your blood pressure and your weight and more.
So when you get to 65, 75, and 85, you can be playing with your grandkids and still going to the park and still, sort of doing all of those. I want to round back, though, to your son aspiring to be a surgeon and in cardiovascular and all the things. And I mentioned it was a calling. And yes, as a parent, sometimes we look at maybe healthcare is not the route you want to go. But I don't want to discourage that, too, because every day we get the opportunity to just really help people in their most vulnerable needs. So even though the system's got its flaws, which is a good thing, so we don't get into that, why is it still important, Dr. Pierre, to have books like Doctor's Moms and having these conversations about our kids, that the viable, route that they can go in those fields?
I think it's all about exposure. So you give them, we were having a conversation about this earlier, you expose them, educate them, let them see, what it entails, and let them decide. So I think it's important to put them around physicians or folks, shadowing those people to see whether they like it or not.
I think in high school now they have and I'm going to get it wrong, something science class where, and someone's screaming it at the radio. I don't hear you, but I do. But it's once they get to their junior or senior year and they get more exposure to some of the healthcare fields, because there's so many different routes and avenues to be able to make a real difference in that way. Where'd you find time to write a book in your busy schedule?
Oh, my goodness. Well, I will tell you, this all started during COVID. So actually, Charlene started the book and she presented it to me, and it just kind of took off from there. So we did not. Time was one of the things that we were trying to figure out. So it took a little bit longer than it probably should have for a children's book because of our schedules. But when it's something that's important to you, and most of all, we hope that it inspires a mom and offers a chance for a mom and their children to bond. So
yeah, and to think about the future too. And when you hear, I kind of felt bad after I said, it was 6 to 7 years, because now looking back, it went by so fast. The schooling did, right? And it's just a blip in the timeline of the rest of your life. So not counting the years and letting that be part of because I guess for your son to make it through, he's looking at 12
more,
more years, and that doesn't scare him off.
No.
Yeah.
And not now. He just turned 12. So, we're early in the game. We'll see where. This is my oldest, so I can see him sticking to it and doing it. But
not letting that deter you, I think, is the thing. If you really want to do it and passionate, the years are going to pass. Yeah. And so you might as well invest in.
Do what you want to do.
The
world is your oyster. I always encourage them. And even my patients, I remember having classmates when I was in medical school. I think one started at 57 years old. Do what you want to do in life.
Was there any other route for you, Dr. Pierre?
What do you mean?
If medical school didn't pan out, or maybe was there something prior to medical school that you wanted to do?
Teacher, which is why I'm at UMMC. I love the balance. Or not the balance, but I love teaching. I'm a teacher at heart as well.
Which is so funny. I was sharing with Miss Alice Clary, who joined us earlier, that I wanted to be a lawyer because of Ally McBeal. Do you remember the TV show?
I do.
I wanted to wear cute dresses or cute suits and then, talk a lot. And then I realized how much paperwork that went into that profession. So God bless every lawyer that's listening to Good Things. Your thumbs must be tired.
Amazing. Yes, they're amazing.
And sort of course corrected. So there's still time for if your kids don't want to go in one route, they can always end up in a different one and that way. Well, it's been a pleasure having you here, Dr. Pierre, and sort of seeing all the different facets and hearing you can be a physician, still a community advocate, an author, and all of those things sort of wrapped in. And as we wrap up sort of talking about the Go Red for Women, what's your final thoughts for folks about this month?
Yeah, thank you so much. So goredforwomen.org, that's where you can find information about us. That's where you can donate. And also just the American Heart Association website. You can go and find, diet recommendations, blood pressure goals, anything, any education material that you need, you can find it there. And then, of course, we're here. Ask us.
You're here and ask us.
Yes.
We should do that next time. Get back and have people ask you their questions.
Sure.
One of the best unutilized tools over at the heart.org is going to be the recipes. I get asked that all the time. What are good, easy, healthy recipes? And I was like, if you need low salt recipes, just go to heart.org. They got a plethora of them there as well.
Yes, they do.
All right, Dr. Pierre, I appreciate your time.
Thank you, Rebecca. This is amazing.
All right, you stick with us. We got more for you coming up next.